Good day, YouTube. Sunday, June 5th today. Weather's just crap over here. A lot of rain. A lot of rain. But that's normal. Anyways, I got the, supposed to have peritonisis on Tuesday. And the infusion, it looks like the phlebotomy is not going to happen. My hematocrit percentage level was too low again, but the ferritin numbers went down to 473. So they still keep creeping down even when you miss a draw once a week. Haven't noticed any difference. Actually had two really bad days. The joint pain, the muscle pain, has been terrible for me. Last night was really bad. This morning I had to take a pain pill by 8. My joints and everything hurt so bad, and got in a nap before noon, but I wish this joint and muscle pain would go away, but it could take a long time for that to happen. Even when your ferritin numbers come back into range, it still could take up to a year. 8 months to a year for the pain to subside, and that wasn't very good news there. But hopefully I live that long, and we'll see on that. But went down Saturday. Had to go on Saturday this week to get my Rona test and get my blood draw. And so I got my Rona test. If you remember, it was a run around last week. So they assured us everything's there and yada yada. So we go down there, I get my lab work done, no problem. And the way they're doing the Rona test there now is you have to have a doctor's order, which I didn't know. But I guess I did have one last week. This is why I ended up getting my Rona test. When you did the drive-through, they didn't care who you were or what you were there for. They just swabbed your nose and sent you on your way. And so I go in there into the ER. They get me right in. You're just at the mercy of everybody else. And luckily, I waited less than 5 minutes. And so I just go into the triage room there, and the nurse is like, yada yada, I've never done one of these before. He's like, do you know what to do? I'm just like, well, yeah, just swab my nose and put it in the vial there and, and send it to the lab. He's like, okay. And I'm sitting there and he hands me the swab. I'm like, just giving him a word look. He's like, well, you can just swab yourself. I'm like, all right, no problem. And so I just swabbed myself and off I went. And I got a phone call a couple hours later, and they're like, we can't use your Rona test. I'm like, well, what happened? They're like, well, you don't have an order, a doctor's order. And I'm confused because this is the first I've heard I've had to have a doctor's order. This is the way you have to do it to have a procedure done. And so we're like, yada, yada. And I was like, well, last week I got it. She's like, well, they only gave you an order for 1 day. I'm like, oh, goodness. And this is my primary care physician. They know I'm doing this weekly. And so why they didn't just put in a standing order for my Rona test is beyond me. So we're like, now what? She's like, really helpful, and I was like, I gotta have my peritonisis. It's scheduled for Tuesday. And it's been scheduled out 3 weeks. And because of their lack of radiologists and whatnot, they're actually bringing in a team of surgeons and they're gonna line us up 2 at a time in these rooms and just start jabbing us all and trying to get caught up on these peritonisis. And some people really need them bad. And if I didn't need one, trust me, I wouldn't let them poke a hole in my belly. But so I'm like, so now what? They're like, well, we got to have a doctor's order. So she's like, you call your primary care Monday morning and tell them you need this order, doctor's order for your Rona test. And here's the fax number. Tell them to fax this thing first thing on Monday morning. This isn't the 15-minute test. It takes a few hours on this one. But so I'm like, oh, okay. And they're like, well, just hold your test at the refrigerator till then. I'm like, well, you've got my test. You took it. And you're going to hold it in the refrigerator. I'm like, you got to know if it's good or bad. And they're like, well, the lab won't actually spin it up until they get that order. I'm like, you got to be kidding me. And so, did talk to the lady in the lab, and she's like, as soon as they fax the paperwork over, the order, and I'll spin it up for you and go from there. So hopefully I'll get the peritonisis. I should, but it's just sometimes they make it really hard to get any kind of treatment. They just keep making it harder and harder and more runaround. It should be like clockwork. To me, it should be like clockwork. But evidently it's not. I gotta pause this just for a couple minutes. I'll be right back. All right, sorry about that. But hopefully everything will go all right on Tuesday. Appointment's at 11, which sucks. I'd rather have mine around 8 or 9 and get it over with and get back home and have the rest of the day to spend with my wife. We don't get to spend much time together, and very little, sometimes only an hour a day. And most days, 2 hours, 3 hours, that's about it. I go lay down in bed pretty early now and try to relax and watch TV in the bedroom, and she works until 4. Sometimes I'm in bed, I usually go in there between 6 and 7. So we don't get to spend much time together. Sometimes she'll come in there and just hang out and watch whatever I'm watching. We don't really watch the same shows at all, but so that's the plan for this coming week. And Saturday when we got home, we just hung out. We've been binge watching Shameless. I think I've said it before, but it's my second time watching it, her first. So we just binge watched that for the rest of the day. And had dinner, and that's about it. And she had to work today, so at least we got yesterday together. She had to work today so she can take Tuesday off, but that's the way that works. It's how she keeps her 40 hours up at work. So the joint pain, it's moved some more. So is the muscle pain up in my shoulders, my arms, and this morning my neck. Maybe I slept on it wrong, but it's like really bad arthritis, I guess, how you could compare it. Dried out joints, I don't know. They don't want to work and they hurt a lot. And I think if it wasn't for them, I really wouldn't have to worry too much about pain pills. But it can get excruciating. The the pain just in my muscles and joints. So, still got that appointment coming up, 22nd, with my gastrologist. Got a list of 6 bazillion questions for her, and find out if I'm gonna fire her or what. But sometimes I just lose confidence in this healthcare. It's just like some of them don't even really care too much. I don't know. My PCP, I've lost all confidence in her. It's this PA that does everything. The doctor, I've only seen him once for 5 minutes, and other than that, it's just the PA doing everything. They have a registered nurse in the office and a couple of PAs, and I don't know what the doctor does, but she signs everything. She's the one that does the meds and figures out what meds I need, when they need adjusted, and it seems odd to me, but maybe that's just the way it is. I do got the appointment with the second primary care physician coming up. I guess that's in July, so it took a few months to get in to see him, and he's tied into the system. He's got everything on me. He knows every procedure, everything. It's all tied into the Sutter Coast Hospital's patient portal. They're all tied together. And so you get something done in one spot, they all know it. And just got to type in my name and date of birth, that crap, and they have everything right there at their fingertips. So, this is giving them some time to go over my stuff. So who knows, he might have different ideas about some of this stuff or different medications. One of them, I'll just tell you, I had to get up and leave just now. The one drug I take, the lactose, it's supposed to be pulling the ammonia out of my body, and you excrete it through poop. That's the way it works, because my liver can't handle it. And so it doesn't give you diarrhea, but you have to go 2 to 3 times a day. I lose stool, I believe, would be politically correct term. So when it's time to go, you need to go. Like I said, you don't have diarrhea or anything like that. But it was kind of weird here last week. Me and the wife were in bed watching TV, and I just kept farting. These are like not your normal. These things went on for like 15 seconds. It's like, holy heck, what's going on? I'm just so full of air. It happens sometimes, especially after a peritonisis. Everything gets moved around, and I get a little farty. But this was going on like every 2 minutes, But thank God it didn't stink, And so we lay in there. It's like, it's got to be one of these drugs I'm taking. I was like, I bet this is what it is. And so I looked up the side effects for lactose, and it's really funny. They go down the list there, and one of the side effects is wind. And then in parentheses it says flatulence and burping. So it's kind of weird. There's nothing you can do about it, Doesn't really make you feel better, like if you got gas from a bad burrito or something like that, So it's just air coming out. I don't know. It's one of the side effects, wind. So now all we can do is laugh about it. My wife would just say, "Sounds like you're a little windy now." Yeah. We had a good day Saturday, once we got back, and that's always nice. But G23, I seen you went up to Lincoln City, complete opposite end of the state. Man, I hope the weather was better for you. It just poured here. And it poured here all this morning, too. So hopefully you had some better weather up north up there. And had a good time, whatever you were doing up that way. And maybe next Saturday I can hang out longer in your live feed. I did bump in and out 2 or 3 different times yesterday, but that's just the way it went. We were talking about my health care, and so I have to jump out, When she's got a day off, we can talk about all this and go over, my blood work. So that's what we were going over. It's all my blood work from Saturday. And seeing how crappy it was. So the 13 things that they checked, only 6 were in the normal range. Some of it I don't even know what it is, but it's about all I really got, I guess, for this week. We'll see how this team of surgeons do on Tuesday. I don't even know if any of them's done this before. But man, they're having a hard time finding doctors down there. It's just, I don't know what else to do, if I can't go down here local as I can get, have to go all the way over to Medford, 3-hour drive each way. But hopefully they'll be able to get it. The nurses actually know more about this than the doctors do. And the nurse gets everything set up. She does the sonogram. She finds a pocket that the doctor can poke, because they don't want to hit my bowels or anything like that. And finds a good pocket, and then they call the doctor in. And they usually tell the doctor, he'll hold this catheter, and the nurse will say, oh, you need to, tip it up just a little bit more. And, she's telling them how to do it all. So I still think they should be able to license these registered nurses to poke the hole. That's the only thing they can't do is put the catheter in. It's a small catheter. It's not that big. I don't know what to compare it in size to. Maybe like the ink tube inside of a ink pen. It might be that big around, maybe. Just the ink tube itself. And it's pretty small. Really it is. And they do everything but, poke it in there. It only goes in about this far, But if they could license them, to allow them to at least poke, they could run the patients through a lot better. They wouldn't be in this spot where they're at on, like they're going to be on Tuesday. They hired a team of surgeons to come in. It's just, it's hard to fathom. I'm like, really, but it is what it is, and hopefully they'll hire some doctors and that want to stay. I don't know why they won't stay. Traveling doctors are coming, some up out of San Francisco, some out of Wairika, and they just don't want to stay up here. They don't want to drive up here. I don't know. But, man, let them registered nurses do it. They know more. The one registered nurse who's a sonogram technician, she teaches a class to the doctors on how to do it. So now it's like really confusing. I'm like, you teach the doctors how to do it, but they won't let you do it. She's like, yep. I'm like, that's pretty interesting. But I guess that's just the way it is. Legal reasons, liability. I don't know. But just gonna hang out today, do nothing. Pretty much what I do every day anyways, but pain levels come down a little bit, after I got a nap in, and hopefully I won't need any more pain medication until bedtime, but help me sleep, get through the night. I usually only take it till like 8:30, something like that at night. It's when I take it. But hope everybody else is doing good. I'll probably sit here and catch up on some other YouTube channels I'm subscribed to and see what everybody else has been up to. And I'll get back to you guys Tuesday or Wednesday, most likely Wednesday. I usually don't do crap on Tuesday, on the days I have the phlebotomy or the peritonitis, and the most I do is eat a Subway sandwich. So, and then I just lay around and yada yada. So probably Wednesday morning I'll cut a video, and I always feel better in the mornings, normally. This morning not so much, but normally I feel pretty decent until around noonish, and start hurting and feeling like crap and abdominal pain, and I'm swelled up pretty good right now. We'll see. Remember last week, I think they might have left a leader in. It's hard to guesstimate, but I can see everything on the inside when they do this. And I'm not a very good judge at liquid volume and metrics, but they probably left a liter in, so I'll probably be close to maybe 6 liters, maybe this time. I'll know more. I'll weigh myself tomorrow night and see how much I weigh, and that gives me something to go by and to determine how much is in me. I'm usually fairly close, just like I was last week, and G23 was really close on his guess as well. But it's pretty accurate, once you get going, like I've said before, on weighing myself. I know how much this ascites weighs and yada, yada, yada. And as soon as they get done, I weigh myself within 5 minutes. I'm on a scale again over at the infusion center. So I know exactly, how much weight I've lost while I laid there on the table. So it's easy to figure out. It's 1.93 pounds per liter of ascites, and which can change a little bit. Mine stays the same. Kind of just looks like a mug of beer. Seriously, it foams on the top, it looks just like a fresh mug of beer. But I did get some good news. Got my daughter tested, and she tested negative, thank God. That puts the grandkid in safe as well. Still waiting on my son to get off his lazy butt and get tested. He still could have it or be a carrier, but it was good news. My daughter's clear, and the grandkid, like I said. So that was really good news for me, and hopefully my son will test negative as well. And if they both do, it's not a miracle, but the odds are against both of them testing negative. One of them technically should test positive. Yeah, the more kids you have, the greater your odds of, one of them tested. Obviously, that's the way the percentage market works. So, just got to wait on him. I bugged him the other day. Get your test, Get that gene test and see if you're mutated like me, If can't stress the importance of testing once we know that I have it full blown. But good news there, good news. And other than that, I'm just gonna chill now and hang out. Already back up to 25 minutes, yabbering about nothing really, but I'm still alive. Things could be better, things could be worse. The joint pain, man, that's just killing me. But not literally, but man, it's pretty painful. And I could take, like I said, that could take 8 months to a year for that to even go away once they can maintain that ferritin level. But it'd all come into check with the liver transplant. But I'm not sure how fast that would turn around the ferritin level. The gene's always going to be there. They can't cut the gene mutation out. But it'd give me a chance, to maintain it and be monitored and blood draw. The phlebotomies once in a while. Some people have it once a month, once every 2 months, once every 3 months, and that's all it takes to maintain them, and they live a healthy, normal life. But you gotta maintain it, monitor it, and keep on top of it, or it will get away from you. So until probably Wednesday, I'm gonna say I'll be out of here, and we'll update on Wednesday, let you know how it goes. Hopefully the Rona test goes through. I was going to cover something else too on the Rona test, but hopefully they get everything in time for the Rona test. And so my wife's in there talking to him on Saturday. She's like, well, how do I get in the hospital now? Because I come in with him when he gets the procedure done, and yada yada, and they let me back, and this and that, and they're like, well, we really don't know. She's like, well, do I just go to someplace and have like the drive-through? She's like, no, those won't work, and yada yada, because it's the wrong kind of Rona test. And so she's like, what you can do is take the home test. And then I'm just sitting there thinking, oh my God, you got to be kidding me again. She's like, they tried this, doing it through the ER before. It's only supposed to be for patients having procedures. And so she's not having a procedure, So she's trying to find a way to get in. And so they say, just bring down your home test, and we'll look at it. And then we'll set you up for 72 hours, that you're allowed to come in the hospital. That's what you get for every test. You get 72 hours of free pass. And so, I'm just looking at her, shaking my head, and I'm not saying anything, And so she's like, guaranteed that would work. And so we're like, all right, no problem. And so we slaunder off over to the lab area, and we're sitting there chatting, waiting. And it's like, we saved one of hers when she was sick here a couple weeks ago. I think I might have said something. So we just saved one of her negative ones. It's been sitting here for 2 weeks now. And it doesn't deteriorate, It's clearly defined negative. So basically, you just bring the same one in, every time you need to come. And she did say something about we just have to trust everybody's telling us, the truth. Other than that, we have no way of knowing. It's like, this is stupid, But that's the way they're going to do it. And so she'll just bring in this test. They take a picture of it. And she, on a piece of paper, they'll have her write her name down and the date and the time she took it. And then they'll put the test up there, and they'll take a picture, and then they'll enter her in the system good for 72 hours. And that's gonna satisfy their needs. And it's the craziest thing I've heard of. I mean, it's like, you could, if there's a market out there, you could sell your clean Rona test out there to dirty people like drugs, a drug test. But, or a pregnancy test, But that's what we got to do. She was just using the drive-through with me half the time, probably not half the time, 25% of the time. She just cheated it and just came in anyways. So they'll give me a visitor sticker, which is really weird. I don't know why. And I'll just take my visitor sticker and give it to her, and she'll stick it on, her shirt. And she's good to go. We've done that a few times. And a few times she didn't even have a visitor sticker. She just kind of like hung around. When they called my name, she just walked back there with me, and no one ever said a word. So I don't know, We go from everywhere's got Rona tests, and they're just handing them out left and right, drive-throughs and everything. And now, you can't even find, something that's really acceptable. But we'll see how long this system works. And there ain't no biggie. She can't come in. She likes to come in because she gets to talk to the head RN, who happens to be the scheduling nurse as well. So they work that out while they're back there, sucking the juice out of my belly. And so they work it out a time and yada yada, and they got that all figured out. So when I get out, the appointment for the next week's already all set up and good to go. But I thought that was interesting, just bring in your home test for Rona. It's like, okay, yeah, we can do that, So anyways, see you guys on Wednesday. If it's raining, stay dry. I think we've had to gotten a couple inches of rain down here. I don't know, but boy, it really poured on us. And stay dry out there, stay healthy, and talk to you guys on Wednesday. Peace out.